Sweet. Thanks, Kevin. All right, this is our 5 p.m. update on the coronavirus in Kentucky. Kentucky, we're going to make it through this. We're going to see a lot of disruption. We're going to see more steps as we go, but we're going to make it. Keep having that faith. I'm going to keep being here every day. We are going to make it together. And understand that while it is taking a lot of sacrifice, and I understand it is taking a lot of sacrifice, what we are doing is protecting the most vulnerable among us. That is our job. And you know what we're doing? We're proving we really care about each other. And we are doing everything it takes to truly care about each other. I know today we've got a lot of kids and families that are here, and we wanted to make sure that we started today with an age appropriate. It's going to be video for all the families out there. When we talk about all being in this together, we mean it, and it's all of you kids too. So while I'm governor of Kentucky, I'm also a dad. I have a 9-year-old daughter named Lila, and I have a 10-year-old son named Will. And like your parents and your caregivers and your grandparents, I love my kids so much, like I know your caregivers love you so much. And while you're out of school right now, I know you have a lot of questions, and maybe even your parents seem a little anxious from time to time, not that they would ever admit it. So we want to make sure today we show you a video, and then I believe we'll have it up online to talk a little bit about this coronavirus. So this video was developed by Dr. Brenzel and his team who work for state government on very short notice. The doctor in it is Dr. Tina Robbins, and she plays the mother. But here's the thing when you watch it. It's her actual daughter, Sailor Birchfield. Dr. Robbins is a psychologist at CHFS. That's just a part of state government that looks out after families. I want to thank KET for on very short notice putting this together. And I want to go ahead and tell you there are a couple of major points in this video. Number one is explaining the importance of what we call social distancing. When you kids watch, you will see exactly what that is. Second is that we've all got to be honest and follow precautions. That's what we teach you kids every day, to be honest with your parents and those around you. We're going to talk about alternatives, which are just different ways of doing things other than in-person visits, which you would normally do. Making sure that you get information from good places, that you know the information you're getting is correct, especially for our kids. Just like in school, we want to make sure you get the right information. We're also going to talk about different things we can do as kids feel stressed. And people don't think that kids feel stress. I know you do. We're going to talk about finding time for some fun and being outside. And I know every kiddo out there loves fun. We're going to talk about that a little bit. We're going to talk about routines at home. Kids, just because you're out of school doesn't mean you should be sleeping in, and doesn't mean you should be eating a lot of sugar, and doesn't mean you shouldn't be following the rules. So we're going to talk about that a little bit too. And then we're going to talk a little bit about communication, but also we want everybody out there to know one of the things I care most about a parent. Parents, as long as you are well, hug your children. Hug them often. It's going to help you as much as it helps them. So let's roll the video.
Hey, sweetie.
Hey.
How's online school going?
It's okay, I guess. Kind of boring.
You seem kind of down. Can we talk?
Yeah, just, Mom, the virus stuff is getting kind of scary.
Tell me what you're worried about. Maybe I can explain some things about COVID-19. That's what they call the virus.
Well, all I know is it's a virus and it spreads really fast.
You're right. It is a virus, and it does seem to spread pretty easily from person to person. And that's why we're taking so many precautions. We're washing our hands a lot. We're coughing and sneezing, into our elbows, those kinds of things.
Not touching our faces, not getting around people. But if we're doing that, why can't we go to Grandpa and Grandma's?
Well, that's a really good question. So remember when Nana and Papa went recently to a hotel and stayed for a few days? So while they were there, they got a little worried that maybe they were exposed to some people that maybe had the virus. And so they're staying away from us so that they don't expose us to the virus.
It's hard not going to their house, because that's where I go whenever I'm on break.
Yeah, I know, you really miss them, and they really miss you too. I think maybe we should call them more, or you know what, maybe you could even teach them how to FaceTime.
Or maybe I can make them a card. They used to love the little drawings I would make when I was younger.
They would really love that. So what other questions do you have?
Well, I know everyone's staying home and washing their hands, but it still seems like people are getting sick. Some people are going to the hospital, and some are even dying. And kids at school were saying that we were all going to get sick and die. Mom, I'm worried that we're going to get sick and die.
First thing is, don't believe everything you hear or everything you read. People don't always get the facts right. And so we always try to listen to the medical experts. And so here's what we know from them so far, and that is that most people who get COVID-19 get better, and most of the time kids that get it have a very, very mild case of it. And so it would be sort of like getting the flu and feeling really, really yucky for a few days and then getting better.
Can we try some coping skills? I used to use them whenever I get stressed about school.
Like you do when you're worried about a test? So in through your nose, out through your mouth. Good, that made me feel better. How about you?
Mm-hmm. But what about the old people? I heard that it's worse for them, and what about Grandma? Is she gonna get sick?
So you're right. Nana does have medical problems, and that's why she and Papa are doing everything they can to stay healthy. If they start showing symptoms, they'll call a doctor. There are lots of people out there that are going to help us stay healthy and can help if they get sick.
Will they get it?
I don't know, but they're doing everything possible to stay healthy. We all are. That's why they close school for a couple of weeks, so that we can keep apart and keep some distance between us so that we're not spreading the germs.
Gosh, 2 more weeks out of school is going to be super boring.
Well, let's think about what we can do to make the days more interesting.
Well, I have a book I want to read, and maybe we can make brownies or cupcakes, hot chocolate.
Yeah, I'm all in for that. And I think you may have a little homework you need to do too.
Yeah.
And now I'm working from home too. And so I think it might be a good idea if we try to come up with a routine for each day, put some structure into the day. So maybe we could start off with some breakfast and then get your schoolwork done, and I can do some work. We can get those things out of the way, and then we could have some lunch, maybe some screen time. Maybe even go outside for a walk and get some fresh air.
Can we go to the park?
Well, going to the park probably isn't the best place to go because so many people are there and they've touched all the equipment, and so their germs may be on it. But we could probably shoot some baskets. I know you love basketball.
Yeah, it's better than being inside, cooped up all day. But I still miss my friends.
Well, what we should do with your friends is FaceTime them as well, right? You guys do that all the time. And maybe you could even write them a letter, like a pen pal or something.
Yeah, like the olden days.
Yeah, like the olden days. So how are you feeling now that we've talked about COVID-19?
Better, but it's still a little worried.
Well, that's understandable. It's perfectly normal to feel really worried. What are some things that we can do when you feel worried?
Well, I usually take a deep breath, or watching a show, or reading a book.
Yeah, those are all great ideas. And sometimes you like to draw or write in your journal. What do you think about that? Would those work for this situation?
Maybe, I think it'll help.
How about we make a deal? How about I check in with you regularly to make sure you're feeling okay, but you come to me if you start getting really worried or if you have some questions. Deal?
Deal. Mom, are we allowed to hug?
Yes. we can hug. We live in the same house. Hey, sweetie.
Hey.
All right. Since we asked kids especially to tune in, we're going to take a 2 to a 3 minute break, which gives parents the opportunity to get their kids active and involved in something else. And let's say 3 to 5 minutes from now, we're going to resume here. Parents, we're going to give the same type of update that we do normally. So make sure that it's age appropriate for your kids if they're going to continue to watch. So again, 3 to 5 minutes. If you're not worried about where you're taking your kids, get a snack, do something healthy, and we will be right back. All right, hopefully that was enough time for everybody to adjust. As we move forward, we're going to keep trying to do things like that. That's going to be posted on our websites. That's going to be on KET's website. As we move through this, everybody, your mental, physical, and emotional health are going to be really important. It's going to be really important for your kids too, and making sure that we are dealing well with that anxiety. Remember, we're having to take some tough steps. And I understand that the uncertainty that creates that anxiety that it creates. I know for many of you, it may create unemployment. But please understand that these steps are absolutely necessary. But we're going to take them. We're going to do it. We're going to get through it. And then we are going to restock, rebuild, whatever it takes to get back to where we were. And you're going to have some patience along the way, which is hard when you're anxious. We'll talk about it later, but I know our unemployment website crashed today. We'll have it back up. We will get to you. We will make sure that you get those benefits, and we're going to be talking about other benefits tomorrow. Just stick with us. Stay calm. Let's stay together. Now, I do want to mention that while, oh my goodness, we have so many great people out there, and they're modeling their behaviors with our hashtags. both Team Kentucky, if we can show it, James, and Together KY. You know, I had a moment last night where I needed a little lift, and for the first time I checked online and I saw what amazing work y'all are doing. I saw you flooding different social media with the positive messages that you're doing, and keep it coming. We're going to need it. And it gives the type of example that we need everybody to follow. And I know you look around and there are some people that aren't following that example. To everybody that is trying to go to places where there are the large crowds and you think you're indestructible, what you're doing can really hurt other people. 80% of people who get this are going to be just fine. You might be one of them. But if it's your actions that ultimately spread it to the most vulnerable, there has to be a responsibility there. So while, again, we all need to stay calm and we'll get through it, it is serious. And there are repercussions if again, we don't all do our duty. So I want to invite Dr. Stephen Stack up. As you know, he's been here with me every time. We're just trying to practice good social distancing and give him an opportunity before we talk about the newest update to, again, just give you the forest from the trees about why we have to do what we're doing. Steve?
Thank you, Governor. So obviously, as we recommend to the governor these decisions and as he takes these decisions, they're really hard. And I want you to know not a single one of them is made lightly, and that there is quite a bit of angst that goes with imposing all these burdens on all of you across the state. 80% of you are going to be just fine, but there's a vulnerable population here, and it could hit them really hard. And I'm going to leave it to you as you study and you do some of your own reading about what that means. But what I need to say, and what I'd like to ask everyone to consider, we've made some really dramatic steps so far, restricting visitation to vulnerable populations, closing businesses, really urging social distancing. But what I need to do is frame this for you. The concept is, in order for us to protect the people we love and ourselves, we have to keep social distance between each other. The one weapon, the one really powerful weapon we have against this virus is to prevent the spread of it between us. And so what this means is, while we've already closed schools, while we've closed restaurants and bars to keep people safe, it means if we haven't listed your particular activity, the concepts still apply. This is not a time to try to find the exemption or the exclusion. This is a time to comply with the basic principle of keeping us apart from ourselves. So if you operate a business, you operate a factory, you operate some type of medical service, if it's not emergent, not urgent, not essential, you have to take steps to thin out your workforce as far as space-wise. We've done it here at the State House and the Capitol, a 50% reduction in employees in the building. You have to take steps to keep yourself spread apart from each other. So I guess is your essentially chief medical officer for the state advising Governor Beshear, I ask you all please to do this. We're doing these hard steps to keep you safe. And I want to urge you, just like the governor said, I do think this is a moment of patriotism. This is an opportunity for us to rise to the challenge and take really difficult medicine to help all of us stay healthy and well. And when we get to the other side of this thing, we're all in it together. We're all going to prevail, and we're going to find ourselves to a better place. I'm very proud to be part of Team Kentucky. It's been an honor to serve for Governor Beshear. I think he's taken the hard steps that are necessary to keep our state safe. I think that they've done the same sorts of things in Ohio, and just like he's spoken to Governor DeWine in Ohio, I've spoken to Dr. Acton in Ohio. We believe this. This is not a party line thing. It's not rural or urban. This is a Kentucky thing, and together, Team Kentucky will overcome it. And I'd like to thank the governor again. I think his leadership is going a long way to keeping us all safe. So thank you, Governor.
Thank you. Can we bring up the line graph that we use? I want to talk a little bit again about duty. We all have a duty in fighting the coronavirus. With something like a virus, it can't just be the duty of those in state government or in a specific field. It's got to be everybody. And when we face this, we have to believe that the steps that we take, the social distancing, the staying home if we're sick, the good hygiene, that it is everybody's duty, because you could be the one that's spreading something, and we have to protect the most vulnerable. Business as usual is that blue line. That is not doing your patriotic duty. That is trying to find exceptions to the guidance that we are offering. That is going to a crowded movie theater when you know we're supposed to be keeping social distance. That is not helpful, and it'll put our people in harm's way. We want to be as close to the red line as we can. If you're close to those other lines, that is about doing your duty. And you know what? It's probably to somebody that you've never even met. It's about truly being your brother and your sister's keeper and doing what's necessary to protect other people. Can you put up Philadelphia and St. Louis? We've talked about this for a couple of days. It's why we have to act as quickly as we act, and we're about to tell you that we have new cases. We're going to have them every day. But we've got to act quickly here, because we have seen in the past, and this is Spanish flu. Again, we believe Spanish flu is deadlier, or was deadlier than certainly the coronavirus. And we didn't have what we have now. We didn't have the knowledge. We didn't have the wisdom, and we didn't have the healthcare system that we do. But what it clearly shows us, if we're not aggressive quickly, then our most vulnerable are at risk. And if we are aggressive quickly, then we can better protect each other. We want to make sure that we are acting more like St. Louis than Philadelphia from 1918 to ultimately 1919, and that we are taking the true steps that we have to. And one thing that happened in Philadelphia during this period is they held a parade. And so if you're flocking to a place, it's almost like a parade. And that is exactly one of the major things that caused Philadelphia to experience what it did during that time. So do your duty. Be a great citizen. It's what we're calling on you all to do. There are no Democrats, Republicans, liberals, conservatives. There are no divisions in Kentucky anymore, and there shouldn't be. It is just us against the coronavirus. And if we truly believe that and we do that patriotic duty, we will get through this. And we'll do it protecting all of our people out there. All right, and tonight's update, we now have a total of 27 positive cases in Kentucky, but we've learned that one of those is actually in New York, but was using a different Kentucky address. So we have 26 cases that are actually in Kentucky. Let me read through the cases. We do have a new county tonight, and that is Lyon County, which we will get to near the end. But again, it says we expect to see the coronavirus all over the Commonwealth. It's what we know is going to happen. That shouldn't create any additional anxiety because we're preparing for this. All right. These are organized a little differently tonight. I don't have all the counties together, so I'm going to just read through them. 27-year-old female from Harrison. 67-year-old, let me say, 27-year-old female from Harrison. Now out of the hospital, tested negative multiple times, fully through it. We're really excited for you. It is a great example for everybody else. Now I'll go back to it. 27-year-old female from Harrison, 67-year-old female from Harrison, 69-year-old male from Jefferson, 40-year-old female from Fayette, 68-year-old male from Harrison, 46-year-old male from Fayette, 60-year-old male from Harrison, 54-year-old female from Harrison, 31-year-old female from Fayette, 56-year-old male from Montgomery, 66-year-old male from Bourbon. Unfortunately, we lost that individual. That was a first. Let's make sure we take all the steps that we have to so that we don't see that happen again and again. Again, it's serious, and we shouldn't be anxious about it. We should just do our duty to make sure we protect each other. To that man's family and friends, we're really thinking about you, and we are going to do our duty to everybody else around us. 67-year-old female from Jefferson, 51-year-old male from Montgomery, 80-year-old female from Jefferson, 53-year-old male from Nelson, 68-year-old female from Jefferson, 51-year-old male from Harrison, 47-year-old male from Fayette, 31-year-old male from Fayette, 73-year-old female from Jefferson, 49-year-old male from Clark, 54-year-old male Jefferson, 34-year-old female from Jefferson, 74-year-old male from Jefferson. The 33-year-old female that we thought was Fayette is in New York, 69-year-old male from Lyon, and a 66-year-old male from Jefferson. We can try to break that down later to figure out exactly what is new and what's not. But again, as we have new labs coming online, and we hope that we will have more as we move forward, as U of L is doing more and others, information is going to come in at different times. We're going to do the best we can on it. I'm going to go through the steps that we've taken as a state like we do every single time, and we're going to announce some new and significant steps once we're through it. We've declared a state of emergency. That allows us to have the extra tools that we need to do a lot of the things that we are doing to address the coronavirus. We activated the Emergency Management Operations Center. We're now at level 3, which is a heightened level of preparedness. It helps us be ready and respond. We activated our State Health Operations Center. We communicate with a lot of our local health departments that way. We announced our COVID hotline, 1-800-722-5725. That is 1-800-722-5725. Tomorrow, we're going to talk about a new infographic. We got a whole lot of people calling that line, and that is good, but we're going to have to start sending people to a couple different places just to make sure that you can get a response in the most timely way. It's good that you're calling. It means that you're reaching out. It means that you're not doing things that would overwhelm our healthcare system. And so tomorrow, I hope you're ready, that we can talk through, or maybe today Steve can talk through some of that new advice, but we want to make sure that you get the type of timely service that you need. We launched Kentucky's COVID-19 informational website. If you could bring that up, kycovid19.ky.gov, kycovid19.ky.gov. Keep going to it. Keep going to it. We will do what it takes to keep it up. We will respond if there are as many visits as we've been seeing. We want you to have good, solid information that you can rely on. And that's why we're driving everybody to this website. We issued the executive order to prohibit price gouging. If you see it, dial 888-432-9257. We adjusted state government sick leave policy, and we are asking private employers now more than ever, make sure that you have paid sick leave. We're publishing the CDC guidelines, and those are changing as we move forward. They are becoming closer to what we've been doing. But remember, if you're over 60, or if you have heart, lung, or kidney disease, compromised immune system, you have diabetes, you are specifically, or you are more at risk for this coronavirus than others. Don't fly. Don't get on a cruise ship. We are recommending social distancing not just for those at high risk, but you need to be engaged in it. Everybody needs to be engaged in it. We are now at a point where it is our civic duty for every Kentuckian to engage in social distancing. We have had calls with all 120 county judges and have them up in the emergency management network. We've initiated changes to Medicaid, as well as put out an executive order for private insurers. We're going to make sure that there aren't any fees associated with getting tested, because we want to get to the point where everybody can get tested. We're not there yet, but we want to make sure that that doesn't come at a cost, and that if you need treatment, that that's not going to come at any extra cost too. We've limited visits to long-term care facilities and nursing homes, except in end-of-life situations. We signed an executive order that allows pharmacists to refill prescriptions for up to 30 days. At the end of that 30 days, we can re-up that order. You ought to expect that. Pharmacists, get ready for it. We're going to make sure that you can provide the services and people can get the medication that they need. We've closed all state prisons to visitors. Schools have shut down for at least 2 weeks. And, we'll have updates, but we ought to be prepared to go longer than that. So I would ask everybody to begin to make the preparations. I don't think that that's any new information, but we've got to do what it takes as we move forward. And we've advised that all community gatherings should be canceled or postponed. You're going to hear more news about that in a minute. We've suspended out-of-state travel for state employees. We're encouraging telework from everybody. And if you are having in-person work, spread people out. Follow the guidelines. If people don't follow the guidelines and can't adjust their work, it makes us make other decisions. We got one chance to cut down our contacts to prevent a spike of cases. That's both to make sure we can provide help for those that we need and hopefully make sure that we have less cases. And so where there are instances where people are not following this advice, it makes us take other action. That's what we got to do to make sure that the actions of some don't risk the health of others. We've recommended the temporary closure of senior centers. We're working on making sure people can get meals. We've announced effective immediately that the Kentucky Mutual Insurance, Employers Mutual Insurance, is going to provide wage replacement benefits for first responders and medical personnel that end up in quarantine or have other issues related to the coronavirus. Boards and commissions in this state are not going to do in-person meetings. They're going to use video teleconference, and they're going to provide links to the public. We have followed the emergency declaration from the Federal Motor Carrier Safety Administration. That allows our drivers out there who are helping in this coronavirus to have the flexibility that they need. We had the USDA approve our waiver to be able to serve meals for students during non-traditional instruction. We've issued guidance to state agencies to decrease their staffing by at least 50%. We're going to keep doing more. We've asked Kentucky hospitals, but let me just say, this applies to all of our medical professions. We keep getting questions that are looking for an exception. Don't look for an exception. If you are a medical provider in this state, you need to cease your elective procedures by close of business on Wednesday. We are going to need you. We are going to need different facilities. We're going to need your help. We're asking everybody to make the same sacrifice. I know that you're thinking about your business and you're thinking about the rest. That's the same with everybody else that has been impacted. We have to be ready, and we need you to be ready. So please comply. We've guaranteed, again, the testing will be free. We've asked Child Care Centers of Kentucky to close by close of business on Friday. This is going to create hardship for a lot of people. It's absolutely necessary. We are going to have some exceptions for essential services like our healthcare providers. They are the front lines. We have to have as many of them ready and at work as possible. We did have to take the steps with a single individual to force a home isolation. Again, we all got to do our part. We've issued tips and guidance to help support good mental health and relieve anxiety. We have now brought, I believe, every passenger from the Grand Princess home. Can we confirm we got the last two? Yes. Well, they are all now home. It took too long. A lot of them went through too much. Two of them, it took even longer. And we're sorry about the way that you were treated. I want you to know that I fought to get you home as quickly as possible. Our nurse that was on the bus, her name is?
Angela Kick.
Angela Kick. Angela performed the testing for our 14. She took their temperatures. She was there with them. Angela, if you're watching out there, you did a great job. We greatly appreciate you. And she went down on the bus for the second day, too. And so, again, we appreciate you. And for all the people on that cruise, welcome back to Kentucky. You're one of us. We're glad you're now at home. We signed an executive order to close all bars and restaurants to in-person traffic. Exceptions for drive-through delivery and in some instances takeout, as long as you're following the guidance. Let me say, everybody out there, order takeout. Do the curbside. This is something that's really necessary for our businesses. Understand how to put out an order that people have dreamed about their restaurant and their small business all their life. They don't know what the future is going to hold. Help them out. This is when we come together as a community. We're going to do it with our family. And if you saw how much my kids eat, you would know that those are big orders each and every time that we order them. We've waived the waiting period for unemployment for people that are losing their jobs due to the coronavirus, and we'll waive any work search requirements while the state of emergency is in effect. We've provided a 3-month extension on driver's licenses. Don't go in to try to renew it. We're going to make sure that there is additional time, and we'll make sure no one's cited or there's any penalty that's out there. We have applied for the SBA Economic Injury Disaster Loan Declaration that provides low-interest federal disaster loans and working capital to small businesses. We received a lot of questions about that after yesterday. We've done that. We have postponed the primary elections by 35 days. That means right now they will be on June 23rd, 2020. Thank you to our Secretary of State for working with us. We've closed the state capitol to non-essential personnel. If you wanted to know how we're taking this seriously, that is a good example, and we are closing state government buildings across Kentucky to in-person services. So those are the steps we've taken to date. Those are a lot, but every day we're probably going to have a little more. So I'm going to announce those now. Today, I've signed an executive order that by 5 p.m. Tomorrow, March 18th, 2020, all public-facing businesses that encourage public congregation or that by the nature of their service to the public cannot comply with the CDC guidelines concerning social distancing are going to have to cease their operations. These businesses must include, meaning these are businesses that are going to have to stop their operations, entertainment and recreational facilities, community and recreation centers, gyms and exercise facilities, hair salons, nail salons, spas, concert venues, theaters, and sporting event facilities. I know there's going to be a lot of questions, but these are all places that people congregate, and it's another step that we have to take to make sure that everybody's sacrifice works, that we can reduce those contacts, that we can change the curve of those graphs. For the avoidance of doubt, there are some businesses that are exempt, and that's because they are critical as we move forward. Providing food, food processing, agriculture, industrial manufacturing, feed mills, construction, trash collection, retail, grocery, and consumer goods, home repair hardware, auto repair, pharmacy, and other medical facilities, biomedical and healthcare, post offices, insurance, banks, gas stations, laundromats, veterinary clinics and pet stores, warehousing, storage, and distribution, public transportation, and hotel and commercial lodging can all remain open at this point, but you've got to follow the guidelines. Every step we take is typically where we see that we do not see the type of social distancing that we must have. For those out there, again, that see their business being accepted or are trying to find an exception, if you're not truly engaging in that social distancing, if you are not taking those steps, it will force some further action. Not that we want to take it, but we got to protect everybody. It's all of our duties. Look for ways to be a part of the solution as opposed to being an exception to what we're putting out there. Couple of other issues. State is working with federal partners to continue the child care assistance payments on behalf of qualified families for centers during the mandatory closure period. The state will also be covering co-payments typically covered by families. Acute facilities should be discouraging all visitors at this time except for end-of-life circumstances. Psychiatric facilities should restrict visitation and only allow it if deemed medically necessary by the attending physician, administrator, and the medical director. We are also recommending that senior care facilities and intermediate care facilities limit visitation only to loved ones that are receiving end-of-life care. And for those residents, they should expect to shelter in place. Those are populations that can be especially vulnerable, and we need to take those steps. We also have interim guidance for adult daycare centers that will require the temporary closure of all licensed adult daycare centers beginning on March the 20th. There's a lot of other information out there. There's some specific information to certain programs, especially through that cabinet. We'll make sure it's on the website and communicated. Again, big steps, important steps. Steps that are going to disrupt daily lives, steps that are going to require people to change the way that we've been doing things, but all of it in an attempt to protect the most vulnerable. We'll also have up on our website different examples of how state government is shutting down in-person services. I'm not going to read these 18 odd pages, but know that we're going to work with you to provide services remotely. I believe that those are our new announcements for today. We will go to questions. What I'm going to do is I'm going to take, if I can, one from the live group, and then we'll switch back to ones that have been sent in. Chris Williams.
Today, the House and Senate leadership sent you a letter saying that they've asked you a couple of times recently to declare a special session which would give them the flexibility to adjourn and then come back for their work. Some in the House and the Senate say that just by being in session, it's dangerous and that they shouldn't be there in those large groups. What's your take on the letter you received, and should they adjourn?
The question is from a letter from the General Assembly where they say we've had certain discussions where they've asked for a special session. I believe their ask is for a special session that would start immediately, that they could adjourn, then come back whenever they want and do whatever they want without a limitation on time period of how long they're here and otherwise. Listen, I've seen some back and forth today. I'm done with politics. We're here in a state of emergency where we are trying to protect the health of people out there. I'm not playing the Democrat or Republican game. I'm not doing the back and forth. We've had a lot of meetings with them, but this is just much more important than that. So here's the deal for the General Assembly. There are two options, and I believe that there are only two options. Number one, pass a budget as quickly as possible and go home. Don't consider other legislation that's out there. Certainly don't consider laws that get people fired up. I mean, people are already on edge and anxious out there. Why in the world would you do that? It's not healthy, and it's not what we should be doing. Now, the reason that it'd be helpful if they passed a budget real quickly and went home is we don't know exactly how long we're going to be dealing with this. And if we go into the next fiscal year, I don't want there to be limitations on funding that might be necessary to address the coronavirus. Now, while I say that, please, for your families at home, know I will do whatever it takes to get us through this and use whatever powers that I have to. But if they would quickly pass a budget and go home, that would just give us some extra security in what we're doing. Here's option two. Go ahead and adjourn. And I will call you back into special session when we believe it's safe. But I am only calling people back in special session to discuss a budget and any legislation related to the coronavirus. To think during a state of emergency where we are supposed to be all in for this, that there be any type of negotiation about discussing other bills and legislation and things that we don't need to be dealing with right now, we are not going to do that. And so I've tried to have good conversations back and forth. I think with many we have, but we're done with politics. We're not going to do negotiations that are political or about this or that. We're just going to do what's right for our people. Those are the two options. If I haven't been clear enough with the legislature, that's what I believe they should choose, one or the other. Next question is about a letter that was sent to me from Dean O'Driscoll, who is the president of the local 83761 on GE. First, there are a lot of rumors out there, and rumors can be tough. There was a rumor out there that a gentleman had passed away that worked for GE that had tested positive. That is not true. But I understand that there are people out there that are working in facilities where people are too close. And I want you to know we're thinking about you and we're making additional steps every day. To any employer out there where that's the case, you got to start taking steps. You have to. And I know that can change maybe the efficiency and change the numbers, but we have to have everybody starting to make steps to create as much social distance as possible. And if you and your business haven't sat down and thought about any way possible to do that, then you're not doing your patriotic duty. I know everybody in any business right now thinks, oh, but us, and we just can't be that way. This is just in us, just all of us, every single family, every single person in Kentucky. We are not a member of this business or this party and that party. We are all Kentuckians battling the coronavirus. Next one, yes.
2 points of clarification, and then I'll lead you to my next question. Are malls...
That sounds like 3 questions.
Yeah, maybe. But are malls part of the order?
Malls are retail, and so not a part of the order at the moment. But again, if you are a mall, practice the social distancing. If we see large crowds gather together, we will have to take steps there too.
Okay, but food courts, of course, will be...
Food courts ought to be closed unless there is an opportunity for what would fall within takeout, and they'd have to take some substantial steps to do that. And any seating area that would get people densely packed in a mall, don't do it. Corner it off, remove the seats.
And then piggybacking off what you just said regarding GE and other facilities, manufacturing facilities are exempt, because we've been hearing a lot of complaints from people who are growing increasingly agitated about being in tight spaces.
Yeah.
Does your administration have any teeth to kind of enforce certain social distancing regulations at these facilities? What would you say to people?
So the question is about manufacturing and how there are folks out there that are nervous and that they are so close together. As people see, we are taking steps every single day. And I hope that they see that we're serious, and not serious because we can do certain things. We're serious because we have to do certain things, and we need everybody to be following the guidelines. So whether it's a manufacturing facility or another group out there, if you don't get serious about this, if you don't do everything you can to create social distancing, then there may come a time where we have to take additional steps. Our economy, we've already had to make serious decisions. I knew yesterday, when I made the decision on restaurants and bars, that a lot of people watching probably were losing their jobs. And if you're one of them, we're going to be there for you. But I knew when I made that order that was going to happen. We will do what it takes. I believe that we all have this resolve to get through it. And thank you to so many of you out there that even sent messages that while you knew that your life was going to be disrupted in this way, you wanted to do the right thing for the people around you. Okay, I think we had this in the video, but this is a question from actually that one of our citizens sent in. My daughter, age 7, is concerned and wants to know if her friends are going to get sick, and if they do, how can she help them? Isn't that incredible? That's an incredible question from those we ought to listen to more. This daughter, age 7, isn't even asking about herself. She's asking about everybody else around her. We need to be a little bit more like her. So to her, if you're listening, it does not appear that this coronavirus impacts kids. There have been just a few reports that have been out there, but for the most part, it looks like kids have very little symptoms at all. And to her and to her friends, you're going to be okay. You are going to be okay. Your friends are going to be okay. But what we need you to do is listen to your caregivers, your parents, those that you're with, and know that some of the things that we normally do, whether you hug your friends or the rest, we're going to have to do things a little differently from now and until into the near future. And understand that you're not going to get to go to as many things with your friends where you all get together, but it's only for we hope, the near future. Thank you for looking out for your friends. There's a second. My son, age 5, is autistic. He is out of routine and has many special needs. Or like many special needs children, he needs a traditional routine the most, and he's struggling the hardest. The question is for experts in the administration is how special needs parents can assist their children during this time when their school-based services aren't being received and there is no routine. I'm looking at my secretary for CHFS. Eric, can we provide guidance on our website in the next couple days? You want to comment on it?
We will provide.
Come on up. Eric Freelander.
Thank you. Thank you for your leadership. In my roles with state government, I was also over the Commission for Children with Special Health Care Needs. parents with children with special needs, it is indeed going to be a unique challenge for you. We are going to provide resources. We are going to provide as much as we can through video, through teleconference, and when necessary, there will be some opportunities for very limited in-person contact. But at this point, your child with special health care needs is actually one of the folks at risk. So we take your question seriously. We will provide as many resources as we possibly can in as many different venues as we possibly can. And know we are here to support you.
Governor Beshear, we've seen lines in some areas at unemployment offices. There have been complaints into our newsroom that the infrastructure is just not ready to go. How are you addressing this?
Right.
And have you seen these reports?
We have seen the reports, and we are working just as fast as we can. So to everybody out there who is now filing for unemployment, we will make sure that we process you. We'll make sure that the dates are the dates that you originally wanted to apply. We are building up as fast as we can. We've never seen anything like this, just like you haven't. We're going to be there for you. I need to ask you two things. Number one, have faith that we're going to do it, because we are. And number two, have patience when it's really, really hard. I get that disruption causes anxiety, and waiting is one of the worst things for anxiety. We are going to get it done. Now, yesterday, our coronavirus webpage crashed. We had 1.2 million views in a very short period of time. We're fixing that. We're going to fix this too. I'm committing all the resources in state government. We are going to be there for you. We're going to have hiccups on the way. We are. As every day something new is out there, we're going to have hiccups, but we're going to be there for you. And I promise you, I will do everything in my power to try to make people as whole as we can as we go through this and at the end. We're going to need a lot of help from the federal government to make that happen, but I will do everything in my authority. I wanted to be governor to help our people. I never expected a time quite like this, but I'm going to take that same approach. I'm going to take that same compassion. I'm going to do everything I can. Yes.
And so the announcement with the adult daycare centers, you know, many of those patients actually qualify to be in a nursing home. And so will there be an increase in home health services for these people who will end up having to be in their home 24/7 as opposed to having that 8-hour day elsewhere?
We'll get you an answer on that. It's about those that are in adult daycare that also qualify for being in a nursing home, and will be there. Will there be additional services at home? I know that we will have guidance up tomorrow, and I went through a whole lot of things really fast. I know CHFS is working on that and other issues each and every day. They'll be reviewing when operations can resume, and we'll get you an update as we move forward. Let me do a couple of more questions, and then we'll go over to Morgan. Are pregnant women at high risk? Dr. Stack, we have not seen them be at more risk, have we? Let's bring up Dr. Stack for that.
So as the question is, are pregnant women at higher risk or at high risk? And like many of these things, there's a lot of uncertainty about this disease. But I guess I would think about this like influenza. We do take extra care and precaution with pregnant women with influenza. And so I think women who are pregnant should take extra care in social distancing, personal hygiene, particularly if you have other children. I know this has got to be very, very difficult for a mother to try to separate yourself a little bit physically from a child who is currently ill, but I think you should take extra care and caution out of an abundance of care. Your newborn child should be fine, but the challenge becomes you as a pregnant individual. Your body changes so much during pregnancy that I would recommend you treat it like the flu, and we encourage you to take extra measures to be avoiding that if possible.
Should they stay home? Will you repeat that question?
So the question is, should they stay home? Should pregnant women stay home? And I would say that, well, it's hard to, I would say that pregnant women should follow the guidance we've given everybody, which is social distancing. We're trying to avoid any kind of aggregation of people and crowds. And if I were in your situation, I would take extra measure of precaution to keep yourself safe. just because there's so much we don't know. So I'm not saying you should be in heightened concern, but you should take extra care, because a lot of things with pregnant women are less certain because your body changes so much during pregnancy.
Thank you. We have a question from a concerned, worried mom about a son who is immunocompromised, asking if we could mandate that schools close, or at least address these holdout schools in a press conference, which we are in. Every school needs to cease in-person instruction. I know all of our public school systems have. If you are a school out there that hasn't, I need you to do your duty. I need you to be closed tomorrow. Do not allow the spread of the coronavirus. Those kids that you have in your class will want to go home and hug their grandparents who may be their caregivers. Let's make sure we make responsible decisions. Is there a concern that by closing child care centers, we will drive child care to parents and grandparents who are most vulnerable to the virus? Every decision we make has negative repercussions, just like it has the positives that we have to make. With every decision that we make, we're concerned about the decisions that other people are going to have to make. But we know that by reducing the contacts, we have the best chance we can to reduce that spike of cases that we want to make sure that we are ready for. Please react to the postponement of Derby and Thunder. It's a great decision. It was the right decision. It was a responsible decision. I don't believe that there was any other decision. Yes, it's going to have a major economic impact. So does everything else. Right now, it's postponed. I certainly hope by September we'll be able to have it. And isn't it great to be able to look forward to something? The House gave readings to a bunch of bills today and sent them back to committee. Let me just say, we ought to only be doing one thing right now, and that is responding to the coronavirus. It would help to have a budget, but debating a whole bunch of our other stuff right now with what everybody is going through is not what I would recommend. What's the status of repairing the servers for filing unemployment claims? Let me bring up our folks to talk about that. Mr. Benton.
Yep. Thank you, Governor. Just a couple of updates on unemployment insurance. We did, as has been mentioned, experience a significant amount of stress to the system today. We've taken some significant action. We've increased our server space fivefold so that we can accommodate more individuals who are filing claims. We are also adding 45 employees to work on unemployment. That is just repurposing our own staff who have experience with unemployment insurance. A couple of significant things that we're asking individuals to do. First is that tomorrow morning we will have an alternative application. So if we are experiencing server issues, that application will be on our website, and you can submit it online, and it will be auto-populated into the system, and your file will be processed immediately. And then also, we're changing the schedule, so we're asking for help here. What we want more than anything is anyone who lost their job this week, we want them to be able to file for claims. And so you'll see a new schedule that's alphabetized that we will be distributing throughout social media and other media outlets, so that if your last name falls into one of those categories, we've assigned you a day to apply. On Friday, that will be for anyone who missed their day, along with the others who are on that list. Next week, we will produce another alphabetized list. This is to decrease stress to the system, but most importantly, to ensure anyone who lost their employment this week that they will be able to file on time and receive their benefits when they're supposed to receive them. And just to give you some numbers on average, for the past several months, we've been averaging about 2,000 claims a week. Today, as we're standing here in the press conference, I received a text that we've received and processed over 9,000 claims today. So there's a significant uptick that's causing stress to the system. We're doing everything that we can to fix it, putting new procedures in place so that individuals who lost their job this week can make sure that they file claims on time.
Good.
The president today said that states can certify their own labs for testing. How does that impact Kentucky? Kentucky maybe have more labs up for these tests?
The question is about labs and certification. I'm going to let Dr. Stack come up here. Let me say we all want to get to the point where everybody who wants a test can get a test. That's going to require capabilities that are not out there right now, that the private sector is not up and running at a level that would allow that yet. We are going to work to get there every day. And until then, we are going to make sure that we are operating with the resources we have on the ground right now. And every bit of advice we give to you is going to be about that. Let's make sure, until there's a chance, that we can test everybody who wants it, that those who need it the most are getting it, especially when most of us will be just fine.
So the question is about the state lab certifying other labs in the state, and that's welcome relief from the federal government, and we just now need the commercial sector to produce the ability in the labs, and then we'll stand ready to get them certified and running, and that we rely on the private industry to get that up and going. So there are efforts underway. I'm optimistic that we will see improvement in the weeks to come, but it is sophisticated science, and we're having labs trying to repurpose gear that was used for other testing to get up to run these tests. So I don't have anything specific to report, but we'll work with them for sure.
Okay. We're going to go about 5 more minutes. I'm going to go through a bunch of questions that were submitted because we got a lot of people, a lot of reporters that are using social distance and aren't here, and I want to make sure we respond to some of their questions. What is the status? Oh, I answered that one. I answered the GE letter. Weddings and funerals. Weddings and funerals are both times that a lot of people come together, and we really need your help. The same type of limitations need to apply. They need to be just the closest of family. Even though a funeral is something that everybody wants to go to who knew the person, we are just at a place right now where that can't be the case. So what I would ask is for those that is tough on, have a private burial, do it with close family, and when we're able to, do a memorial service afterwards. I'm the grandson of Orlando Russell Bashir, who operated a funeral home that's still called the Bashir Funeral Home. I know the importance of that to so many others. Weddings. I know so many of you have probably planned. You put down payments. You've waited for this day. If you have a large group together, it's going to spread the coronavirus. No one wants to see that on their wedding day. So take the steps that are necessary. Either have a very small ceremony of just family and friends or postpone it. That's just where we are. I have something that says bars were open and people were sitting inside drinking in Germantown and Louisville last night. Folks, you cannot do that. This is a mandate that is out there. If necessary, people will come by and enforce it, but don't be that one institution while everybody else is sacrificing, that you aren't being willing to do the same, and don't be the person that would go knowing that we shouldn't. This is a time of patriotic duty where we need everybody on board. Again, we want to be able to make recommendations and people do the right thing. And when one group doesn't, it makes it more difficult on everybody else. Is mail-in voting possible to implement by the June 23rd new date for the primary? We'll still have to see. I know that the Secretary of State is looking at a number of different options, and I appreciate that. There's questions about would it require a law change? We're still looking at that too. We are going to have to make all different types of plans as we get closer to that date, and asking for some alternative to in-person voting is certainly a possibility, just like everything else. We don't want people congregating in places, and we'll see as we get closer to there, but also understand that a whole lot of our poll workers are our seniors, and we are not going to ask them to do that. And if we are still facing what we're facing now in June, I'm not going to ask them to do it then either. I'm not willing to put our people at risk. There's a question about childcare available for on-site employers. We're going to have specific guidance for that up on the website. I want to make sure that we get the right information. Have we heard cases being linked? It's to a specific facility in Lexington. I don't want to mention it because we haven't, and I don't want it out there that we've made a connection with a specific Lexington employer. When we are able to announce connections, we will. Did the governor tell legislators to continue the session and they would not call a special session? Folks, I'm done with the back and forth. This is just, there's no time to do this as we are in a state of emergency. I believe there are two options for the legislature. Number one, stop doing anything else, pass that budget, pass it quickly, take whatever days off you need to in the interim, and go home. The other piece is go ahead and adjourn, and I will call a special session that will include the budget and anything related to the coronavirus. But in a time of where the state has declared an emergency, for there to be negotiations about an open-ended special session that we start today and could go on, recalled at any specific time for any amount of time and talk about anything in it, we're not doing that. That is just not where we are as a people. Those are the two options that are out there. And if they haven't been communicated clearly to the legislature, they are now. Any reaction to Senate President Robert Stiver's floor speech today? I haven't seen it. The budget is critical. We are glad that he tested negative. Listen, I may disagree with the Senate President on different times. Before this year, we may have had some rocky times the 4 years before, but I care about his health, the health of his family, just like I care about everybody else's health. We're going to take 3 questions, and then we'll be out of here.
Your order for closing adult daycare centers by the end of the week, is that also for child care daycare centers to close?
All of our child care daycare centers, yes, are going to close and need to close by the end of the week. There are certain exceptions that are going to be in the policy. One that I just want to point out is healthcare workers.
Are you working on logistics for that? How would that work?
We're going to have guidance out on the website, but it's the question is, are we working on logistics for it? It's going to be a hardship. It is. It is going to be tough on a lot of parents, a lot of caregivers that are out there, and we know it's going to be tough. And I know that even working on logistics, we're not going to be able to fully make up for it, and it's going to be tougher on our families that are out there. But we are doing the right thing. We are doing what's necessary to get through it. Yep.
In the event that infection rates do spike and hospitals are overwhelmed, have you and the administration have had serious conversations about converting certain facilities into, say, field hospitals or triage centers? And can you shed some light to those conversations?
So the question is, if we see the spike in cases and our healthcare system hospitals are overwhelmed, do we have contingency planning in for using other facilities, pop-up hospitals and the like? I want to point out how important our order on ending elective procedures is. I'm sorry, it's a recommendation for now. By the close of business on Wednesday. Let me say I've heard from a close friend of mine who is in an area where you could have argued it should have been an exception. He is doing his duty, but he looks around at people in his profession, in his specific field, and he is rightfully upset about people saying that they might not comply with this unless it's absolutely ordered. We need every single healthcare professional, every single facility to stop those elective procedures by close of business Wednesday. We are in talks to make sure we define it appropriately because we're going to need all of them just to make sure our healthcare systems aren't overwhelmed if we have that spike of cases. We know we will have a spike of cases. My goal is to make sure our healthcare system is not overwhelmed. But we're planning for everything, so people should know even if we see that, yes, we have a lot of contingency planning. We're looking at lots of different facilities. We're looking at facilities that the state has. We're looking at pop-up even tent facilities if we have to. I will use every resource in this state, every dollar that I have at my disposal, every personnel that we have to do everything we can to protect everyone's loved ones if we see a spike that is that significant. And Kentucky will need your help if that happens. We'll need your help staying calm. We will need volunteers. We will call on you, and I know you'll respond. Last question.
Are you confident that the state is doing enough to make sure rural and smaller community hospitals are prepared or are dealing properly with an influx of patients they may already be seeing who are waiting to be tested? And what is the state doing to help those hospitals?
So the question is, are we doing enough to help especially rural communities and rural hospitals that are or will see an influx of patients? Questions about testing and everything that goes along with it. We're working and we're trying to work with everybody. Now, there's probably every community that's out there that feels like they don't have enough resources, and right now, that's just about everybody, which means we got to use good judgment, which means we got to make sure that we are providing the resources for the sickest. Remember, this is a disease that 80% of people are going to be okay. That means that even when we don't have everything we'd like right now, but we do expect to see more in the future, if we are good citizens, if we know that maybe we got it, but we will be okay, we're in good health, that means there are the resources there for other people. This is truly something where we can lessen the impacts by being really good people. Let me add to that, being good people is about being good citizens and doing your patriotic duty. Put the hashtags up again, if you will. We need you to model that. Because if that question is true, that there was an establishment open last night and lots of people were in it, they were not on Team Kentucky. We need everybody to be together KY and on Team Kentucky. Model your good habits. I can't tell you how many people I called today for one reason or another. They were out on a walk. They needed it. They were just at a place where, whether it was them and their kids or the others, that they just needed that break where they were practicing that social distancing. So we're talking about a lot of things, and things may get harder in terms of disruption as we go. They're unquestionably going to get harder. You know, we announced yesterday about bars and restaurants, and today virtually all other entertainment centers. Those are hard orders to make as a governor. I get the impact that it's going to have on people, and I feel it too, and I hope you know that. But it's my job to protect our family and our friends. And I believe it's all of your civic duty to help us do that. So please engage in the good example, the good behaviors, what this country and what this Commonwealth needs from you at the moment, and share it on social media. And after you've shared it on social media, turn it off. Take the time, practice good hygiene, but make sure you're not watching all this stuff 24/7. Now, make sure you watch every minute of this as we do it. But even if this gets overwhelming, turn it off too, and we'll get you the other information. Everybody that I'm dealing with right now, my first question is, how are you doing? And so from a 6-foot distance, when you interact with people, ask them if they're taking care of themselves. Ask them how they're doing. We will get through all of this, but it's all of our duties, each and every one of us, to look out for each other and to make sure that we lessen the impact of this, that we protect our relatives, and that everybody do that duty. I hope everybody has a good night. We're going to be back at 5 p.m. tomorrow. I will tell you that we're doing it at 5 because we've got some news stations that are carrying this live. I know that some of our print newspapers, it's better for 4 so they can meet their deadline. If those groups want to get together and make the best recommendation for us, we'll try to follow it. But I do want to have a regular time each day where we do this, and right now that's going to be 5. To those who also really like the 9 o'clock, I got to get through this too. And as we move forward, I hope you understand that doing it once a day helps me do everything else that we are doing during the day. Thank you all very much. Kentucky, we're filled with amazing people. We're going to be okay. Stay calm, adjust to the disruption. It's going to be tough, but we're going to be just fine. And I'm going to be here with you every step of the way. Thank you all.
Thank you.